standards against which we assess trusts cover issues that really matter to patients. Issues such as safety, cleanliness, waiting times, infection control. So really important issues. And the good news from this year's results, and this is the third year of the annual health check, is that 60% of the NHS has performed what we describe as excellent or good against those tough standards. And that's a complete turnaround from where we first started. When we first started, 60% of the NHS was in the weak or the fair category, so in the lower two categories, and now 60% are in the top two categories. That's really good news for patients.
These are important standards for patients, not just for the health service, and we've always therefore believed that it was right that they should form the foundation of what we do. We want to do much better than that, but if at the very least we need to deliver the foundation.
The public are concerned about the issues relating to infection control. What the results show this year is the MRSA rates have come down and the C. diff rates are beginning to come down too.
Ward cleanliness is important, and there is a cleaning program that's well established within the organisation. There is a regular inspection, and the cleanliness of our environment and our wards has actually improved considerably over the past 2 years. It's a common problem within the older population, and one of the steps that we did, together with the consultant microbiologists and the infection control team, was to review our antibiotic policy.
Would you say it will be okay to prescribe these antibiotics?
As part of our review of the practices and policies, we decided that if somebody had been in hospital before and was known to be MRSA positive, it was helpful for the clinicians, when the patients come back to hospital, to have some kind of alert in their medical records. I think what people often forget is that as clinicians, we are actually also users of the service at one point or another, and it's important, it's in our interest to make sure that policies and procedures are actually effective.
I think this year we've very much focused on the hygiene code because we wanted to make sure that we'd got that right, because that's a high priority for our patients and that's what they tell us is a high priority. What we want to do in future, though, is to up the number of external reviews we do, and this year we've got 6 reviews planned.
We've got patients that need to have a blood count result available before the medical staff and clinic can see them. Those blood tests have to go to the laboratory along with all the other 1,000 samples a day that we're processing. So we needed to be able to identify those samples and actually make sure that those patients' results got pushed through the system and down to us in a timely way. That's brought about considerable improvement. Patients are happier, they're not waiting now for results, and the doctors are happy because they're not waiting around until they can actually see the patient. So that's been a great success, I think.
We see the annual health check and the process that we go through as being extremely valuable for building the foundation of what we do. But our focus has always been on what is it that patients actually want and expect, and that's our focus. And you can engage all your clinicians on that particular journey. So I think we've got great opportunities to take this much, much further than we thought possible.
We have a particular problem in Rotherham because of our background industrial history, that we have a large proportion of patients with respiratory disorders, particularly chronic bronchitis and emphysema. If you have a patient who is admitted with an exacerbation of their chronic bronchitis, we make a decision as to the patient, whether the patient is fit to go home or requires hospital stay. And then we institute the early discharge scheme, whereby we may let the patient out into the community, but we ensure that all the treatment that's required and all the nursing care that's required is then back in the comfort of their own homes, rather than being locked away in hospital with what I believe may be social isolation for some patients. Our length of stay has dropped from a peer value of about 6 days down to 4.5 days for this hospital. Okay. We've also managed to reduce the number of inpatient beds from our previous 3 wards now down to 2 wards.
What for us is important is that we don't only just use the annual inpatient survey as part of our work plan around patient experience, but we also develop our own processes, which we have done through our patient experience strategy.
This ward has been created for the purpose of looking after patients with haematology, rheumatology and dermatology conditions. It was really key that the team who work on this unit actually had input into the design and planning of the ward and were able to influence the design. And they, of course, because they work every day with the patients, are taking continuous feedback from our patients as to how the environment works for them. So they were able to then feed into the design and planning meetings, and we were able to put right the design of this new one.
As an organisation, we have 4 clear strategic priorities. Our number 1 is patient safety. Our number 2 is the patient experience. Number 3 is performance beyond the expectations of our patients. And number 4 is efficiency. So actually the organisation is driven largely by quality and the patient experience, not by the financial position of the trust.
Actually, my own observation is that those trusts which are performing well out there have an enormous pride over what they're doing on behalf of patients. And what we actually see in the NHS is the best getting even better. So when we started this assessment 3 years ago, there were only 2 trusts which were awarded what we describe as a double excellent, and this year there are 42, which is absolutely great.